Now, I want to wrap up. I want you to hear from one of our clients. And every single one of you in this room, mental health is an issue that affects all of us. 1 out of every 5 people in the world are affected by mental health. In Canada alone, where I live, it's a $51 billion problem. It's a problem that is near and dear to all of us. And what I'd like to do now is introduce Dr. Tom Doub. He was, when we first got to know each other, the COO of Centerstone Research, a mental health care institution in the Midwest. Now he's actually the CEO of CRI. Tom, please join me on stage.
So I'd like to ask all of you just to think for a moment about the impact of mental health on your own lives. Can you go back one? Sorry. Whether it's depression in a family member, ADHD in a child, a friend dealing with alcohol or drug abuse, these issues affect all of us. And that's what Centerstone does every day. We serve 70,000 people a year who are recovering from mental health and addiction problems. At the Research Institute, what we're focused on is using research, technology, and ultimately data to help improve the care that we provide every day. So today I'm going to talk about 3 areas with you. 1, how did we get started on our analytics journey? 2, about how we solved a big business challenge. And 3, I'm going to look forward and talk about how these issues can help us as we address larger healthcare problems. But before we get into the weeds, I want to briefly say thank you to Les and IBM for inviting me here today to share our story. The first step for us was pulling together our resources and creating a center of excellence for analytics within the organization. We had our IT staff, we had statisticians from research, we had people in our quality group. We put them together into a team and we gained efficiencies and synergy from working together. Now, as we did that, we realized we had to work closely with the business. So we looked for areas where we could gain small wins, simple problems that we could solve. One of the areas we identified is in our community-based services, where we have staff going out into the community to work with kids in schools or work with homeless people in shelters, adults in their homes. We weren't getting paid for everything we did. In fact, we were only getting paid for about 75% of what we did, which in our industry is a problem because revenue equals help that we can offer. It equals lives saved. So for us, inefficiency translates to a lost opportunity to make a difference in our mission. We created some tools working with the business that created transparency, data transparency, very simple stuff, that helped those managers find opportunities to improve their billing. All they had to do was see exactly what was happening in their system and they could fix it. We had one manager in particular, represented in the purple line behind me, who started the ball rolling. This was our early adopter, our champion, who said, you know, I'm going to go first. It may not be perfect at this point, but I'll go first and I'll adopt, and we're going to hold ourselves accountable to this. She got such terrific results in a short time that everybody else got on board. And within 6 months, we drove our efficiency in this area from 75% to over 95%, which is a huge difference for us. At the same time, we had initiatives looking at access. How quickly can people get into our care? This is a big issue. When somebody calls and they're depressed, you can't say, oh, well, we can see you in a month. They want help today. So by creating data transparency, democratizing information, we were able to find inefficiencies in our system that our management was able to use to improve our access to services by 35%, helping people get into care more quickly. Next, for a big business challenge that we faced. In 2010, the state of Indiana changed the way they paid for mental health and substance abuse treatment services. About 20 different regulations changed at once. And we had a hard time. We brought our smartest people together in the room. We had a hard time figuring out exactly what it is that we should be concerned about with so many changes. I'm sure none of you face regulatory changes. So we built a straightforward what-if modeling tool. We took our data from 2009, we applied what-if scenarios to each of those 20 changes where you could flip them on and off, and through that we could see, first of all, what really scared us. If nothing changed from one year to the next, we faced a 50% cut in our revenue. Devastating to our business and truly devastating to the people that depend on the services we provide. But through our modeling, we were able to identify we had about 3 areas that we had to really be concerned about. And we were able to focus on those from a management standpoint to re-engineer those operations. For us, since everything was changing at once, it was like going from being a football team on one day and playing by those rules to being a basketball team on the next day and playing by a completely different set of rules. Now, in that, we actually found opportunities. Once we got over the initial fear, frankly, and concern we had about the changes and looked at the data, we found areas in the data where the state was making opportunities available to us to transform our care. Now, at the end of that year, the rest of the state, statewide, lost 26% of their revenue in our business, a very significant loss. Our loss was 4%. And in fact, year over year, we served more people, better serving our mission. Now, looking forward, healthcare is a significant challenge for all of us, no matter where we live around the world. The key in healthcare, as it is in many industries, is achieving value, improving our outcome at a lower cost. So imagine that I run a weight loss center, and I have a program where I can help you lose 10 pounds for $500. It's $50 a pound. The way I improve is I can either reduce my costs or I can increase the number of pounds that you lose. That's ultimately what we're looking to do in the healthcare sector by creating efficiency and improving our outcomes. The promise in medicine is it's about personalized medicine. So behind me you see, for 2 clients who may have the same diagnosis, one size doesn't fit all. It may be that one person as an individual, just like the example we just heard, needs a different course of care than the next person. And through that, we don't deliver unnecessary services, which reduce our costs, and we're able to help them more successfully and more rapidly achieve a positive outcome. The key for us, as we think about this looking forward, is to work smarter, not harder. Finally, in closing, I just have to say, this work could never have been done without the vision and generous philanthropic support of Jim and Jana Ayers with the Ayers Foundation and the Josie Davis Foundation. They've been with us every step along the way. Thank you very much.